Question 1. Based on the information provided, how should Mr. Thompson, a radiation therapist, handle a situation in which the patient is experiencing severe anxiety before treatment? A. Proceed with the treatment as scheduled without addressing the patient's concerns. B. Refer the patient to a psychiatrist for immediate intervention. C. Provide emotional support, discuss the patient's concerns, and ensure clear communication to reduce anxiety. D. Ignore the patient's concerns as they are unrelated to the treatment process. Answer. Correct answer. C. Explanation. The ethical principles of healthcare, particularly within the ASRT, American Society of Radiologic Technologists, radiation therapy curriculum, emphasize the importance of patient care, including addressing emotional needs. Radiation therapists must provide emotional support, discuss any concerns the patient has, and communicate treatment processes clearly to reduce anxiety. Ignoring or dismissing a patient's concerns lead to distress and may affect the quality of the treatment experience. In contrast to option A, therapists should never proceed with treatment without ensuring that the patient feels comfortable. A referral to a psychiatrist, B, might be necessary if anxiety persists, but is not the first course of action. Ignoring the concern, D, is against the ethical guidelines of patient-centered care. Question 2. In the context of radiation therapy, what is the primary purpose of the inverse square law in dose calculations? A. To determine the proper positioning of radiation beams. B. To calculate the difference in intensity of radiation with distance from the source. C. To ensure that patients are exposed to the minimum possible dose. D. To adjust the energy of the radiation beam based on tissue density. Answer. Correct answer. B. Explanation. The inverse square law is a fundamental principle in radiation physics that states that the intensity of radiation is inversely proportional to the square of the distance from the source. This law is essential in determining how radiation dose changes as the distance from the source varies. By understanding and applying the inverse square law, radiation therapists can accurately calculate and control the dose delivered to the target while minimizing exposure to surrounding healthy tissues. This principle is critical in treatment planning and ensuring the safety of both patients and personnel. Option A relates more to patient positioning, while C is more about patient safety, and D pertains to energy adjustments which are not directly related to the inverse square law. Question 3. When analyzing the impact of radiation on tissues, which of the following factors most significantly affects tissue radiosensitivity? A. The presence of tumor necrosis factor TNF in the tissue. B. The oxygen level in the tissue at the time of exposure. C. The stage of the cell cycle during radiation exposure. D. The dose rate of the radiation used. Answer. Correct answer. B. Explanation. Oxygen plays a critical role in enhancing the radiosensitivity of tissues. This concept is explained through the oxygen enhancement ratio, OR, which suggests that tissues exposed to radiation in an oxygenated state are more sensitive to the effects of radiation compared to hypoxic, low-oxygen tissues. This is because oxygen helps stabilize free radicals formed during radiation, which can cause damage to cellular DNA, while tumor necrosis factor A, the cell cycle stage C, and dose rate D also affect tissue response. Availability has the most profound impact on radiosensitivity, making B the most accurate answer. Question 4. During the treatment of a patient with head and neck cancer using intensity-modulated radiation therapy, the radiation therapist notices that the patient is not positioned correctly. What is the most appropriate action? A. Continue with the treatment as planned, as small errors in positioning are acceptable. B. Pause the treatment, recheck the patient's position, and reposition if necessary to ensure accuracy. C. Complete the treatment and adjust the position after the session is over. D. Immediately terminate the treatment and refer the patient back to the oncologist. Answer. Correct answer. B. Explanation. In radiation therapy, particularly with advanced techniques like precise patient positioning is crucial to deliver the correct dose to the target area while sparing healthy tissues. Errors in positioning, even minor, can result in improper dose distribution, leading to ineffective treatment or unnecessary damage to surrounding tissues. ASRT guidelines emphasize the importance of accuracy, and radiation therapists are expected to ensure the patient is properly positioned before proceeding with treatment. Pausing treatment, Rechecking and repositioning B is the most appropriate and responsible action to ensure treatment accuracy and patient safety. Options A and C are unacceptable because they compromise treatment quality and patient safety. Option D, while involving patient care, does not address the immediate need for proper positioning. Question 5. Under the assumption that a patient is scheduled for a stereotactic body radiation therapy (SRT) procedure, which of the following is essential for treatment success? A. Utilizing a broad radiation field to treat the tumor. B. Positioning the patient with minimal setup accuracy. C. Administering a single high dose of radiation over a few sessions. D. Ensuring high precision in tumor localization and dose delivery. Answer. Correct answer. D. Explanation. Stereotactic body radiation therapy (SRT) is a highly precise form of radiation treatment that delivers high doses of radiation to tumors in a limited number of sessions, typically 1-5. Precision is paramount in SRT as it allows the radiation to be concentrated on the tumor while minimizing damage to surrounding healthy tissues. Localization of the tumor is achieved using advanced imaging tech like ET accurately position the patient before each treatment. Option is incorrect because SRT focuses on precise localized radiation, not a broad field. B is incorrect as accurate patient positioning is crucial, and C does not describe the treatment schedule accurately as SRT is typically completed in fewer high-dose fractions. Question 6. To better understand radiation safety principles, why is it crucial to apply the ALARA as low as reasonably achievable principle during radiation therapy? A. To maximize the radiation dose to the tumor. B. To minimize unnecessary radiation exposure to patients and healthcare personnel. C. To ensure the treatment is completed quickly without concern for radiation safety. D. To comply with insurance requirements for radiation therapy procedures. Answer. Correct answer. B. Explanation. The ALARA principle is a core component of radiation safety and is designed to minimize unnecessary radiation exposure to patients and healthcare personnel while still achieving the desired therapeutic effect. The principle involves assessing the risks and benefits of each procedure and taking steps to reduce exposure as much as reasonably achievable without compromising treatment quality. This is particularly important in radiation oncology, where the risk of long-term effects due to radiation exposure can be significant. Option A focuses on dose escalation, which contradicts the principle of minimizing exposure, and C neglects safety, while D is not the primary motivation behind ALARA. Question 7. Esther Davis, a patient undergoing external beam radiation therapy (EBRT) for prostate cancer, is experiencing some mild skin irritation in the treated area. Which of the following is the most appropriate course of action? A. Discontinue radiation therapy until the skin irritation resolves. B. Inform the physician and continue the treatment, but monitor the skin condition. C. Apply an over-the-counter topical ointment to relieve irritation. D. Increase the dose of radiation to reduce the irritation more quickly. Answer. Correct answer. B. Explanation. Skin irritation is a common side effect of radiation therapy, especially in areas that receive direct exposure, such as the skin around the treatment area. The proper course of action in this case would be to inform the physician and continue treatment while closely monitoring the condition. The physician may offer additional recommendations, such as moisturizing creams or adjustments to the patient's care plan. Discontinue radiation therapy. A could interrupt the treatment plan, and increasing the dose. D is contraindicated as it could worsen the irritation. While topical ointments, C, may help, they should be used under the physician's guidance, not as an independent solution. Question 8. From the perspective of treatment planning, why is it important to delineate the target volume accurately during radiation therapy? A, to ensure that the entire tumor receives the prescribed dose while sparing healthy tissue. B, to reduce the number of treatments needed by increasing the dose to the target. C, to help the oncologist make a more accurate diagnosis. D, to ensure the treatment area matches the size of the radiation machine. Answer. Correct answer. A. Explanation. Accurate delineation of the target volume is crucial in radiation therapy to ensure the tumor receives the prescribed dose while minimizing exposure to surrounding healthy tissues. This is particularly important when using advanced techniques such as IMIT, where precise dose distribution is required to maximize tumor control and minimize side effects. The treatment plan must be tailored to the tumor's size, location, and delineating the target accurately is the first step in achieving this. Option B suggests increasing the dose unnecessarily, which could increase side effects, while C and D are not directly related to treatment planning. Question 9. In terms of regulatory guidelines, how should a radiation therapy department ensure compliance with safety standards for radiation equipment? A. Conduct regular calibration and performance checks of radiation machines. B. Only perform equipment checks when an issue arises. C. Rely solely on the manufacturer's instructions for machine operation. D. Use the radiation machines continuously without testing to ensure productivity. Answer. Correct answer A. Explanation. Regular calibration and performance checks of radiation machines are essential for ensuring they function correctly and deliver accurate doses. These checks are required by regulatory bodies such as the NRC Nuclear Regulatory Commission and must be documented as part of quality assurance procedures. Routine maintenance and calibration help to avoid errors and ensure patient safety. Option B is incorrect because checks should be performed proactively, not reactively, relying only on the manufacturer's instructions. C. Without regular testing could lead to undetected issues and continuous machine use without testing. D is a violation of safety protocols. Question 10. During the process of treatment planning, why is it important to consider tissue absorption factors when calculating the dose of radiation? A. To determine how much radiation is absorbed by the tumor. B. To adjust for the depth and composition of tissues in the path of the beam. C. To ensure the machine settings are optimized for the tumor type. D. To reduce the time spent on treatment planning. Answer. Correct answer. B. Explanation. Tissue absorption factors refer to how different tissues in the body absorb radiation differently based on their composition and density. This is critical when calculating the dose because tissues like bone and muscle absorb radiation more effectively than others like air or fat. Considering these factors ensures the radiation dose is delivered accurately to the target area while minimizing unnecessary exposure to surrounding tissues. Option is too simplistic as the consideration of absorption involves the entire path of the beam, not just the tumor. C and D are not directly related to the absorption characteristics of tissue. Question 11. In a context of quality assurance for radiation therapy, consider Mr. Richards, who is the lead medical physicist responsible for the calibration and performance verification of the new linear accelerator in his department. Over several weeks, Mr. Richards has been meticulously reviewing the calibration data, output factors, and machine stability results. Given the critical nature of accurate machine calibration and the potential implications for patient treatment safety, which of the following steps is most crucial to ensure continued compliance with regulatory standards and best practices? The procedure should not only verify the machine's dosimetry but also validate its long-term performance consistency, aligning with both the NRC guidelines and internal quality assurance protocols that are essential under the ASRT curriculum. A. Conduct routine scheduled calibration and performance verification tests using standardized dosimetry equipment and document each test meticulously. B. Rely on unscheduled reactive calibrations only when output inconsistencies are detected by end users. C. Primarily depend on manufacturer-provided calibration certificates without performing independent verification tests. D. Allow the machine to operate continuously, extended periods to generate more data before initiating any calibration procedures. Answer. Correct answer A. Explanation. Routine scheduled calibration and performance verification tests are fundamental to ensuring that a linear accelerator consistently delivers the prescribed radiation dose with high accuracy. Under regulatory guidelines, such as those provided by the Nuclear Regulatory Commission (NRC) and reinforced by ASRT standards, it is essential that medical physicists like Mr. Richards perform regular checks using standardized dosimetry equipment. These tests verify not only the machine's immediate performance, but also its long-term stability. Option B is unacceptable because relying solely on reactive calibrations may allow undetected drifts to compromise patient safety. Option C is insufficient since independent verification is cornerstone of quality assurance, and Option D neglects the need for proactive maintenance, risking treatment errors. This rigorous approach aligns with best practices and demonstrates adherence to professional standards and regulatory requirements. Question 12. Based on the information provided, imagine MS. White, an experienced dosimetrist, is planning a treatment for a patient with a complex tumor in the head and neck region using intensity-modulated radiation therapy MS. White must account for the variable tissue responses along the different beam paths through heterogeneous tissues that include bone, muscle, and air cavities. Given the role of radiobiology principles in treatment planning, which factor must be carefully considered to predict how these tissues will respond to the delivered radiation dose? The planning process should integrate radiobiological models that reflect both immediate cellular damage and long-term tissue effects while maintaining a focus on tumor control and healthy tissue preservation. A. The mechanical stability of the treatment couch during patient setup. B. The precision of patient immobilization devices used during simulation. C. The oxygenation status and radiobiological characteristics of the tissue. D. The electronic calibration of dosimetry equipment prior to the procedure. Answer. Correct answer. C. Explanation. In advanced radiation therapy planning for complex regions such as the head and neck, the oxygenation status and inherent radiobiological properties of the tissue are critical factors in determining the tissue's radiosensitivity and overall response to treatment. Radiobiology models, which are central to the ASRT curriculum, emphasize that tissues with higher oxygenation levels exhibit greater sensitivity to the oxygen enhancement effect, which stabilizes radiation-induced DNA damage. Option A, focusing on mechanical stability, and option B, regarding patient immobilization, while important, do not directly address tissue response to radiation. Option D pertains to equipment calibration rather than biological tissue response, thus thorough understanding of tissue radiobiology. C allows dosimetrists like MS. White to optimally balance the therapeutic dose, increasing tumor control probability while mitigating adverse effects on normal tissue in accordance with both clinical protocols and regulatory standards. Question 13. Given the circumstances of ethical practice and patient care under the ASRT guidelines, consider Nguyen, an experienced radiation therapist who has encountered a scenario where a long-term patient expresses concerns about the confidentiality of their treatment records during a busy treatment day. With increasing scrutiny over data privacy and the potential for breaches in clinical settings, Nguyen must choose the most appropriate course of action. Which of the following choices best adheres to both ethical principles and regulatory policies regarding the safeguarding of patient information? The decision should not only protect patient rights but also ensure that clinical operations continue smoothly while upholding professional responsibilities. A. Dismiss the patient's concerns as misunderstanding and continue with the treatment process without addressing the issue. B. Immediately report the potential breach to the hospital administration and verify that all patient records are secured, then communicate corrective measures to the patient. C. Reassure the patient about confidentiality but later document the concern without implementing any immediate changes in practice. D. Transfer the patient to another therapist without addressing the confidentiality issue to avoid any delay in treatment. Answer. Correct answer. B. Explanation. Patient confidentiality is a cornerstone of ethical practice in radiation therapy, and it is strongly emphasized within the ASRT curriculum. Nguyen is obliged to protect sensitive patient information in accordance with HIPAA regulations and other data privacy guidelines. Option B is the most comprehensive approach since it involves both immediate reporting and action to secure patient records and proper communication with the patient regarding the measures taken. Options A and C do not adequately address the patient's valid concerns or take proactive steps toward compliance, and option D unnecessarily disrupts patient care. Adopting option B reflects commitment to ethical principles by combining prompt administrative action, professional accountability, and transparent communication, thereby reinforcing culture of trust and safety in clinical practice. Question 14. Considering the evidence provided by recent internal audits, Dr. Parker, the chief radiation oncologist, encounters an unexpected interruption during a high-dose stereotactic radiosurgery (SRS) session when a minor technical malfunction disrupts patient positioning. Given the inherent risks associated with high-dose treatments and the stringent safety regulations governing SRS procedures, what is the most appropriate immediate act for the treatment team? The decision requires balancing rapid response to technical issues with the rigorous safety protocols outlined in both institutional guidelines and external regulatory requirements to ensure that the patient is not inadvertently exposed to an unsafe treatment environment. A. Reassess the patient's treatment plan immediately during the ongoing session without halting the procedure. B. Continue with the treatment while making adjustments based on estimated patient positioning corrections. C. Pause the treatment, conduct full equipment and positioning check, and re-establish proper alignment before resuming the session. D. Cancel the session entirely and reschedule the treatment for another day, disregarding the potential impact. Overall treatment continuity. Answer. Correct answer. D. Explanation. In cases of a technical malfunction during SRS, the primary concern is the safety of the patient due to the high-dose nature of the treatment. Option D suggests cancelling the session entirely and rescheduling, which is the safest course of action when a precise treatment cannot be confidently delivered. This option is based on strict adherence to regulatory safety procedures, ensuring that the possibility of delivering a compromised dose is eliminated. Although pausing and rechecking, option C, might seem appropriate, the unpredictable nature of high-dose SRS demands a reassessment with potentially a full system reboot and verification to ensure patient safety. Options A and B involve continuing the treatment despite the risk of inaccuracies in patient positioning, which is not acceptable under rigorous safety standards. Cancelling and rescheduling, as in option D, best aligns with the protocols that safeguard patient well-being and complies with both professional and regulatory guidelines. Question 15. Throughout the course of treatment planning for a patient with prostate cancer, Isis Garcia's clinical team must determine the optimal use of immobilization devices to ensure accurate and reproducible patient positioning. Given the multiple options available, from customized molds to vacuum lock systems, the team must integrate patient-specific factors, treatment modality nuances, and detailed anatomical considerations to ensure both precision, patient comfort during high-dose delivery. Which of the following choices best represents the ideal approach to selecting and utilizing immobilization devices in this context? A. Selecting device solely based on cost-effectiveness without considering its precision capabilities. B. Randomly choosing between different immobilization devices to reduce patient anxiety through variety. C. Evaluating each device for its ability to maintain reproducible patient positioning while considering the specific anatomical and treatment requirements, and then selecting the most suitable option. D. Relying only on historical data from previous patients regardless of variations in individual anatomy. Answer. Correct answer. C. Explanation. The effectiveness of radiation therapy relies heavily on the accurate and reproducible positioning of patients, which is achieved through appropriate immobilization. In Isis Garcia's case, evaluating each available device in terms of its ability to maintain alignment and accommodate anatomical variations is paramount. Option C emphasizes comprehensive assessment that considers clinical requirements, anatomical constraints, and patient comfort. This practice is consistent with the evidence-based guidelines set forth in the ASRT curriculum and industry standards for treatment planning. Options and B overlook the necessary technical precision and individualized assessment, while option D fails to acknowledge individual differences among patients. By choosing option C, the treatment team ensures that immobilization devices are selected based on a robust evaluation process, which in turn supports accurate dose delivery and minimizes treatment uncertainties. Question 16. With respect to treatment planning principles, Mr. Collins, a senior dosimetrist, is tasked with developing an optimal external beam radiation therapy (EBRT) plan for a patient with deep-seated abdominal cancer. In this process, he must account for variables such as patient anatomy, beam energy, tissue absorption, and potential organ motion. Given the complexity of the scenario, which aspect is most crucial to ensure that the prescribed dose is delivered to the target volume while limiting exposure to surrounding healthy tissues? A. Focusing solely on the physical dose prescription without considering patient-specific anatomical variations. B. Precisely delineating the target volume and integrating advanced imaging and motion management strategies to account for organ movement. C. Prioritizing speed in treatment planning to shorten patient time on the treatment couch. D. Utilizing a broad beam approach to cover potential areas of microscopic disease spread with detailed planning. Answer. Correct answer. B. Explanation. For complex cases such as deep-seated abdominal tumors, precise delineation of the target volume is paramount. This requires integrating advanced imaging techniques, e.g. MRI, and implementing motion management strategies to address organ motion. Option B is correct because it ensures that the target area is accurately identified, thereby allowing for precise dose delivery while minimizing exposure to critical structures. Option A neglects patient-specific variations, while option C compromises the thoroughness of planning, and option D could result in unnecessary exposure to healthy tissue. The ASRT curriculum emphasizes the accurate target delineation, supported by advanced imaging, and accounting for organ motion are essential to optimizing treatment outcomes and ensuring that the delivered dose aligns with the planned dose, thereby upholding both treatment efficacy and patient safety. Question 17. When evaluating the principles of radiation physics in the context of treatment delivery, consider Mr. Patel, an experienced radiation therapist who is reviewing a treatment plan using inverse square law calculations to adjust beam intensities. In his analysis, Mr. Patel is particularly focused on ensuring that the treatment machine parameters align with the theoretical model's underlying dose distribution. Which of the following best exemplifies proper application of radiation physics fundamentals in this scenario? A. Applying the inverse square law to accurately adjust beam intensity based on the measured distance from the radiation source to the patient's target, thereby ensuring the prescribed dose is achieved. B. Ignoring any discrepancies in calculated dose distribution because modern machines are pre-calibrated and require no further assessment. C. Utilizing the inverse square law only as rough estimate without performing detailed dosimetric measurements. D. Modifying beam intensity based solely on the color mapping of the isodose curves without considering distance factors. Answer. Correct answer A. Explanation. The inverse square law is a fundamental concept in radiation physics that dictates how the intensity of radiation decreases with the square of the distance from its source. Mr. Patel's effective application of this principle ensures that the beam intensity is adjusted so that the radiation dose delivered to the patient matches the prescribed dose accurately. Option demonstrates correct application by factoring in the distance from the source and using precise dosimetric measurements. Options B, C, and D are inadequate as they either disregard detailed calculations or rely on incomplete assessments, which can jeopardize treatment accuracy. The ASRT guidelines emphasize that solid understanding of radiation physics, including the inverse square law, is critical for ensuring that theoretical models translate into safe and effective clinical practice. Question 18. In light of recent developments in image-guided radiation therapy (MS), Brown, a radiotherapy specialist, is responsible for ensuring that the images used for patient localization are precisely registered with the treatment planning CT scans. Given that errors in image registration can lead to mistargeted dose delivery, which of the following actions is most essential in minimizing such errors? The quality and consistency of image acquisition, as well as the subsequent fusion of images from different modalities, are pivotal for accurate treatment delivery and must adhere to both institutional protocols and regulatory standards. A. Relying solely on visual inspection of the images without quantitative analysis during registration. B. Depending exclusively on automated software to perform image registration without operator verification. C. Conducting a thorough manual review and adjustment of the fusion between planning and verification images while cross-referencing with anatomical landmarks. D. Skipping the image registration process when the patient anatomy appears symmetrical. Answer. Correct answer D. Explanation. The accurate registration of images is critical to ensuring that the planned radiation dose is delivered precisely to the target area. In this scenario, neither relying solely on visual inspection nor depending entirely on automated software B is sufficient. Rather, a detailed manual review in conjunction with automated processes C is necessary to identify and correct any discrepancies that might occur. The fusion process. Option D, which suggests skipping the image registration process, is unacceptable as it disregards the fundamental requirement for precise alignment, thereby increasing the risk of error in dose delivery. By combining manual review with quantitative validation, clinicians such as MS Brown ensure that image-guided radiation therapy is delivered safely and accurately in accordance with both internal and external quality assurance protocols, forth in the ASRT guidelines. Question 19. When analyzing the factors that influence cell radiosensitivity in the context of radiation therapy, consider Mr. Evans, a radiation biologist investigating how intrinsic cellular properties contribute to treatment outcomes. Mr. Evans is particularly focused on evaluating the effect of cell cycle phases and molecular repair mechanisms on the sensitivity of tumor cells to radiation. Given the complex interplay between biological processes and physical dose delivery, which factor is recognized as most significantly modulating the sensitivity of cells during radiation exposure? A. The presence of heavy metals in the treatment environment. B. The phase of the cell cycle during which the cells are irradiated, given its influence on DNA repair capabilities and consequent radiosensitivity. C. The technical specifications of the radiation machine used for the treatment. D. The ambient temperature in the treatment room during exposure. Answer. Correct answer. B. Explanation. Cellular radiosensitivity is strongly influenced by the phase of the cell cycle at the time of irradiation. Cells are most radiosensitive during the GM phase and relatively resistant in the S phase due to differences in DNA repair capabilities. This concept, thoroughly discussed in radiobiology principles within the ASRT curriculum, underscores that understanding cell cycle dynamics is critical to optimize timing and delivery of radiation doses. Option and D focus on extraneous environmental factors that have minimal direct impact on cellular radiosensitivity, while option C addresses technical rather than biological variables. Recognizing the central role of the cell cycle, B helps clinicians and researchers fine-tune treatment schedules to maximize tumor cell kill while sparing normal tissues, a strategy that is essential for advanced radiation therapy practices. Question 20. With respect to the integration of different treatment modalities, Dr. Kumar, an interdisciplinary radiation oncologist, is developing a comprehensive treatment strategy for a patient with an aggressive form of cancer. The treatment plan involves a combination of external beam radiation therapy, brachytherapy, and chemotherapy. Given the complexities associated with synchronizing multiple modalities, what is the key consideration that guide the successful integration of these treatments while ensuring the highest level of patient care? The decision must balance the timing and sequencing of therapies, address potential cumulative toxicities, and adhere to rigorous clinical protocols that underscore the collaborative nature of modern oncology. A. Initiating all treatment modalities simultaneously to maximize the therapeutic effect. B. Utilizing only one modality at a time to simplify treatment delivery. C. Carefully sequencing the treatment modalities based on tumor biology and patient tolerance while coordinating multidisciplinary input to optimize overall efficacy and safety. D. Allowing the patient to choose the preferred order of treatment modalities. Medical guide. Answer. Correct answer. C. Explanation. The integration of multiple treatment modalities in cancer care requires careful planning, especially when combining brachytherapy and chemotherapy. Option C is correct because it emphasizes the importance of sequencing treatments based on both the tumor's biological characteristics and the patient's overall health and tolerance. This coordinated, multidisciplinary approach, which is a central theme in the ASRT curriculum and broader oncology practice, helps to maximize treatment efficacy while minimizing cumulative toxicities. Options and B oversimplify the approach, potentially leading to suboptimal outcomes, while option D undermines the necessity for professional clinical judgment and coordination. Carefully sequenced and integrated treatment plan C ensures that each modality complements the others, resulting in an optimal balance between tumor control and patient safety while adhering to established clinical guidelines and ethical standards. Question 21. A commercial property underwriter receives a proposal for a warehouse located in a flood-prone area. The building is made of non-combustible material, but there are no flood prevention measures in place. Which of the following underwriting actions is most appropriate? A. Decline the risk outright due to location in a flood-prone area. B. Accept the risk at standard premium rates. C. Require implementation of flood mitigation measures before acceptance. D. Accept the risk with an exclusion for flood-related losses. Answer. Correct answer. C. Explanation. Flood risk is a major concern in property underwriting. Underwriting best practices, e.g., anti-flood guidance, recommend risk improvement measures rather than immediate rejection if the core risk is insurable, requiring the implementation of flood mitigation measures such as barriers or drainage systems, aligns with prudent underwriting and allows for potential acceptance after risk reduction. Question 22. A large retail tenant occupies the ground floor of a building. The lease agreement makes the tenant responsible for insuring their contents and improvements, but the landlord insures the building. Which cover should the underwriter recommend to the tenant for their business interruption risk? A. Gross profit cover based on the landlord's policy. B. Declaration-linked business interruption policy with 133.3% uplift. C. Loss of rent policy tied to landlord's building insurance. D. Increased cost of working only since the tenant has no insurable interest in the building. Answer. Correct answer. B. Explanation. The tenant has an insurable interest in their own operations and improvements. A declaration-linked business interruption policy with a 133.3% uplift allows flexibility and coverage for fluctuating turnover. This is suitable for retail risks with seasonal or unpredictable revenues. Question 23. A manufacturer is applying for business interruption coverage. The underwriter notices a 60-day lead time for replacement of a critical machine sourced overseas. What is the most appropriate action the underwriter should take? A. Recommend a longer maximum indemnity period. B. Decline the risk due to excessive delay. C. Offer standard coverage with no adjustments. D. Apply a coinsurance clause to encourage better maintenance. Answer. Correct answer. A. Explanation. A long lead time for equipment replacement directly impacts the duration of business interruption. Underwriting guidance suggests adjusting the maximum indemnity period to account for the time it takes to fully recover operations. Typically, underwriters recommend 12, 18, or 24 months depending on complexity and recovery timeline. Question 24. A property risk involves a mixed-use building with residential units above and a ground floor restaurant with deep frying operations. Which factor would most likely lead to risk loading or coverage restriction? A. The presence of residential tenants above. B. The use of deep frying equipment in the restaurant. C. The building's location near public transport. D. The absence of an elevator for residents. Answer. Correct answer. B. Explanation. Deep frying operations present a high fire hazard due to the use of cooking oils and open flames. Underwriters typically require fire suppression systems such as Ansel systems and may apply premium loadings, warranties, or restrictions. This is consistent with standard fire risk underwriting guidelines. Question 25. A client operating a cold storage facility requests business interruption insurance. The risk assessment indicates a high reliance on electrical supply with no backup generator. What is the most prudent underwriting requirement? A. Apply a high deductible. B. Require installation of a backup power source. C. Decline coverage due to unacceptable risk. D. Restrict cover to physical loss only. Answer. Correct answer. B. Explanation. Cold storage operations are extremely sensitive to power failures. Loss of temperature control can result in spoilage and substantial business interruption losses. Requiring a backup generator is a reasonable and standard risk mitigation step in property underwriting for such operations. Question 26. An industrial client requests business interruption cover, but their financial statements are unaudited and show irregular income patterns. Which approach is most appropriate? A. Decline the risk due to lack of verifiable financial data. B. Offer cover but base the sum insured on estimated figures plus a margin. C. Accept the risk at standard terms without further checks. D. Request audited statements and delay quotation until provided. Answer. Correct answer. D. Explanation. Underwriting business interruption coverage requires accurate financial information to determine the correct sum insured and indemnity levels. In the absence of audited financials, the underwriter should request verification to avoid underinsurance or disputes at claim time consistent with underwriting due diligence practices. Question 27. A building is occupied by a tenant running a paint manufacturing business. The underwriter observes that flammable solvents are stored in an unventilated room near heat sources. What is the most appropriate underwriting decision? A. Accept the risk with an increased premium. B. Require risk improvements before coverage is granted. C. Decline the risk due to high combustibility. D. Cover only third-party liability risks. Answer. Correct answer. B. Explanation. The improper storage of flammable materials near ignition sources is a serious risk but may be mitigated through proper ventilation, segregation, and safety measures. Underwriters often issue risk improvement requirements as a condition precedent to cover based on fire hazard mitigation guidelines, e.g., FM Global Standards. Question 20. A long-standing client has recently expanded operations and doubled the number of employees. However, the existing business interruption policy has not been updated. What is the underwriter's best course of action? A. Issue pro rata endorsement immediately. B. Cancel the policy and issue new one. C. Request updated financial and operational information. D. Do nothing until the next renewal cycle. Answer. Correct answer. C. Explanation. A material change in operations such as expansion requires the underwriter to reassess the risk and ensure the coverage still reflects the business's current size and exposure. This is essential to avoid underinsurance or inadequate indemnity periods, aligning with the principle of utmost good faith. Question 29. A policyholder with business interruption cover is concerned about losing customers to competitors during a shutdown. Which extension of cover is most appropriate to address this concern? A. Loss of rent. B. Additional increased cost of working. C. Customers extension. D. Loss of attraction. Answer. Correct answer. D. Explanation. Loss of attraction cover protects against loss of revenue due to decreased footfall or demand, often caused by damage in the vicinity or disruptions that deter customers. It directly addresses concerns over customer loss during a temporary shutdown or disruption. Question 30. An underwriter is reviewing a business interruption proposal. The client has multiple revenue streams, one of which is a seasonal holiday business that generates 60% of income in December. What is the most appropriate basis of cover? A. Gross revenue with a 12-month indemnity period. B. Gross profit with an adjusted sum insured to reflect seasonality. C. Increased cost of working only. D. Declaration-linked cover with no seasonal adjustment. Answer. Correct answer. B. Explanation. Where seasonality significantly affects turnover, underwriters should use gross profit cover with an adjusted sum insured to reflect peak periods. This ensures adequate indemnity during critical months. Seasonality must be accounted for to avoid underinsurance.